it was a very easy system to get into, and it seemed like a commonsensical space to be in. And I think it's very easy for anyone who's interested in understanding the world of infections and diseases, in wanting to have an early warning, in wanting to plan out.
Hello, all. I am Janavi, and I welcome you all to the Impact Out today with Dr. Angela Chaudhuri. She's a board director at Catalyst Foundation, leading the health practice across the Catalyst group of institutions, and a partner at Swasti, the health catalyst. Angela spends most of her time framing the discourse from health to well being while orchestrating elements of social behavioral management and technology around the technical or medical aspects with a strong focus on prevention and promotion. She has been leading the COVID response through the COVID Action Collab, a people centric, partnership led multidisciplinary collaboration that supports the most vulnerable survive and thrive during humanitarian crisis. Having a degree in dental sciences, master's in public health, and PG diploma in journalism, she has worked in 30 countries so far. She serves on the board of the Catalyst Foundation and Swasti, and up to most recently, PMNCH, a global alliance hosted by WHO. She's a part of the social participation technical network of the WHO. It's great to have such an experienced person like you today, ma'am. So, a warm welcome to you, and I'm really looking forward to our conversation.
Thanks so much.
So, ma'am, we are all aware about the various kinds of epidemics and typically wastewater based diseases. The whole approach of looking at diseases has largely shifted, typically after COVID. Our health system is being cautious about treating these diseases, but for ensuring prevention of the same, we need to put in more effort into the system at large. So, how would you reflect on the need of increased awareness about wastewater or sewage surveillance system for COVID-19 and the other epidemiology?
So that's a very pertinent question. I think the idea is that we have been running behind any disease. Any disease comes up, and we try to look for ways to treat them, ways to find who's gotten the disease, and a whole bunch of protocol around it. But India's been smart. We've had integrated disease surveillance project that has been a part of the National Center Disease Control, and we've been doing population-based surveillance. We've also been doing environmental surveillance, like you mentioned, wastewater surveillance for polio. This is not very common in many countries, but has been very successful in finding and eliminating polio in our country. So all we did was to just take a leaf out of somebody else. There was a Dutch water research institute that said that was able to prove that it's quite possible to look at viral remnants, not the virus itself, so no one gets infected by wastewater, but people release genetic material when they go to the washroom, and that is what you find in wastewater surveillance. So having a continuous monitoring process that looks at various diseases, COVID today, polio was yesterday and continuing today. Tomorrow could be H1N1, monkeypox, whatever nature throws at us. I think if it's viral and people are shedding it in their stool, that is something that wastewater surveillance can help. And what happens is that it's not intrusive. It doesn't go into people's houses. It doesn't go into the hospitals. It's something that naturally flows. And so, if a city keeps a watch on what comes out, it would help, so the city planners and public health and clinician professionals to actually address issues.
Mhm. Right. So I would really like if you highlight the need of this awareness. Like, why should people take that seriously? The surveillance system, typically after COVID.
I think with or without COVID is just a signal that
Right.
surveillance is important, and therefore that's why they should take it seriously. Where else will you get information? There's only one place where people get information from is if somebody is sick and bothers to visit the doctor, or sick enough to visit the doctor, and the doctor finds out what happens.
Mm.
And in a pandemic, that becomes too late. And as you saw, that the systems got burnt out very, very quickly. We still have cities that don't have wastewater surveillance, still have no idea how it will be tomorrow or day after or the day after that. They don't know if, many people have monkeypox or no one has monkeypox. We don't
Mm.
know. A lot of people are falling sick in all cities in the country. Weather is changing. We don't know if it's a regular cough, cold, if it's influenza, or if it's COVID, because each of these infections runs through the body differently, affects different people differently. That's why it's important.
Right. Ma'am, you have been into this space for so long as an active stakeholder in mobilizing support for last mile during the unusual times of COVID. So, what would you say are the challenges in the public health surveillance system at present?
So, to be honest, I've been in the public health sector and working with communities for a long time. But surveillance itself, it's just been a year and a half. I think COVID gave me that opportunity to get into it. So I haven't been in the system for a lot, as long. However, it
Hmm.
was a very easy system to get into, and it seemed like a commonsensical space to be in. And I think it's very easy for anyone who's interested in understanding the world of infections and diseases, in wanting to have an early warning, in wanting to plan out what the
Hmm.
response would be, is a space to occupy. It's very cheap. The technology is out there. I think the challenge is, how do you translate science, the data and the analysis that you get, to something that is useful and something that governments can work on. That is the biggest challenge. That is something that the entire world of surveillance is working on. So we're not alone in saying that, we're still figuring out, we're learning as we go along. I think the entire world is faced with the challenge of what do you do with surveillance? Because surveillance doesn't just belong to the scientists, it doesn't just belong to the clinicians, it doesn't just belong to the government administrator, it belongs to everybody, it belongs to you and me. You also need to know if you're in a safe environment. And if there is public dashboard available, one can say, hey, it looks like cases are going up. Maybe today I wear the mask, because those are all this personal decision one makes. You don't have to wait for a government mandate to wear a mask. You might want to wear a mask sooner. One might have a condition, maybe diabetes, or maybe they're susceptible to certain infections. Maybe they're quite elderly and need to be more careful, etc. So I think having surveillance that is public is important, because it then gives you a tool to make decisions better for yourself.
Right, right. So, as I can hear, surveillance is something which is a collective responsibility, which belongs to us all, as you are saying. So, in your opinion, what could be the ideal way to solve these challenges sustainably?
It's really simple. If cities invest a little bit of amount of money in surveillance, be it environmental surveillance or population surveillance, and keep sustaining it and not waiting for a pandemic or a virus to threaten that situation, they will get a wonderful integrated dashboard that keeps telling them that they're on the right path, or there is something coming, or they've been successful in treating something, or there is a locality that needs more attention. So, as a result of these kind of decisions, they're able to be agile and they're able to mobilize resources where it is required than spending a lot of time or doing guesswork. So, that's where I see that resources, people should pay attention and resources should be there.
Right, right. And
And,
in
and the
this,
benefits are really, yeah, sorry, go ahead.
no, no, ma'am, please go ahead. The benefits.
I think the long term benefit is that it is sustainable, because the source of the data is sustainable. As long as people are eating, they are going to the washroom, and as long as they're going to the washroom, it is being flushed down. It's anonymous, so nobody knows. It's not about my disease or your disease. It's about a population and what infections might have. And for example, right, monkeypox, there's so much of stigma. It's so new and young, and there's already a lot of stigma about it, just like there was stigma about it, about HIV. But environmental surveillance destigmatizes because it's population level data. We don't point at any individual, for the infection, but we're able to say, hey, monkeypox is here. We need to be careful. And it's quite low tech. There isn't a lot of huge amount of science that is required or a lot of technology requires, very fancy setup. So I think in terms of long-term sustainability, it's quite easy to do it. One just needs to have the political will and the interest to do evidence-based public health programming.
Right. So, ma'am, this is the issue that needs to be dealt with on different levels. So, as you said, right from generating awareness on a community level to some policy level change. So, I would like to ask what role at multiple levels can different stakeholders play in tackling these challenges and, as you are pointing out, ensuring the sustainability of the solution that we are working towards?
So I'll start from the community. I think as community public, we need to look out for the dashboard and demand and ask for information and be happy and use the information when it's useful to us and spread it out. While at the same time being very responsible on not creating panic and spreading misinformation. I think open source data dashboards that people trust is a good way to fight infodemic. As you realize, during COVID, there are a lot of wrong information going around, and having a dashboard that has the proper information is a tool to fight infodemic, and one might be responsible for spreading responsible information and stopping that. Then I would say on in this on the in this on the role of researchers and academicians is to take the information that is already out there and do more with it, because the surveillance is basic information, but you can do a lot more in terms of modeling, in terms of predicting, in terms of doing cost efficiency studies and all of that. And these are important because for the entire community, public health belongs to everyone. It's not one person's responsibility. So that is one good way in which researchers and academicians can contribute. Also, while building the students' understanding of what is wastewater-based epidemiology and how that supports public health, good public health policy and decision making. Then I would come to the side of private sector. There are lots of private sector labs, startups, enterprises, all have a space in the value chain of wastewater-based surveillance. You could be a lab, you could be a company making diagnostic material. Whatever that sector does, I think it would be good if there was low cost, specific and sensitive diagnostic material so we get results faster and in a way that it can be used by anybody, not someone who's extremely qualified or trained in something, because we must make science more usable and utilizable. And then, of course, is the administrators. One, from having the political will to support resource it within their system and making it part of their planning and how they have public health, to actually using the data for action. You can have surveillance and you can have surveillance without action. So one wants surveillance with action. And therefore, one is to resource it, one is to make sure it's part of the planning, one is to ensure that, because this is the job of the government. It is not the job of outsiders, but outsiders can support the government in making such systems happen. And the second part of it is, of course, using that information and inviting experts to make sense. It's not easy for either just the administrators or the scientists or the clinicians or the academicians or civil society to actually come to conclusions themselves. But when they come together and look at the data together, you get very powerful messages and get very powerful action plan. And that needs to be sustained.
Right, right. Now I would like to come to COVID Action Collab. It's I mean, it's in Karnataka and it's catering to wastewater surveillance. So I would really like if you could elaborate on how this came into being and what is Swasti doing with it and why you picked the geography of that intervention.
Okay, so COVID Action Collab is a pan-India, initiative. It's not based out of Karnataka. It's just that the wastewater piece is based out of Karnataka. But COVID Action Collab is an initiative of more than 360 partners all over India, and it was set up because COVID was not just a deep issue, that it was also a wide issue. It meant that a lot of different actions needed to happen, not just health, but also livelihoods, economic resilience. As you know, the most vulnerable got affected quite badly. In these partners, we have partners who are providers, who are grassroots organizations, who are implementers, and those that enable through technology, communications, etc. And what COVID Action Collab is leading towards is really towards resilient and thriving vulnerable communities, effective and efficient institutions, and a dynamic humanitarian response system. And that is what happened, right? During COVID, we needed a dynamic humanitarian system. The idea for COVID Action Collab was to look at the people who are vulnerable, and there are various vulnerable communities that we have focused on, like adolescent at risk, elderly, people with disabilities, people who live in crowded slum communities, fishers, farmers, etc. And there are trans and men who are sex with men, people who are left out of systematically, informal workers, street vendors, etc. So all of these people we wanted to reach because they were not being reached. One of the solutions is the precision platform, and we were trying to solve for understanding what was the community prevalence of COVID, because there's a shortage of tests, and those who are getting tests were really not from any of these vulnerable groups. After some time, we realized that this was an efficient early warning system. And if we worked closely with the government and supported them, then the impact would be seen. And we chose Bangalore because we're based out of Bangalore. And when you do research and innovation, you want to be in a place that you are close to. So you're able to see all the failures very quickly and learn from successes and scale it. So that is what COVID Action Collab is about. This is one of their programs. There are bigger programs like COVID vaccination program, the telecare program, as well as the self-testing and community-based testing program.
Right, right. So it's such a great initiative, I think, truly people-centric and catering to the different needs of different kinds of people and not just one particular community-based. I would further like to ask, what is the long-term value addition of sewage surveillance systems in terms of catering to other diseases? And are there any merits of this system over the traditional methods?
So there are no, I mean, the traditional method is about case by case. So if someone is infected and they feel sick and they want to get themselves tested, and now we have rapid antigen tests. So people test themselves, they get better, and they come out. So we don't have a way of knowing what is the infection about. The second thing is that, as we have learned through COVID, is that genomic testing is extremely important, because if we don't know what kind of variant has infected us, then we don't know what might be the clinical progression, and therefore how infective it is, or how sick a person might be, is actually from the genome variation testing that we do. And therefore, it is important to have all of it and move to environmental surveillance, because it's low cost, it's scaled up, it speaks for a population, it doesn't speak for one or the other person, and it wants us to take action ahead of time. And therefore, it is also applicable, as I said earlier, on most infections, particularly those with RNA or DNA, which are viruses. And some bacteria can be looked at wastewater, because wastewater, it goes through time. There's industrial effluence, there's rain, there's sun. So it's not as clear as a clinical sample, but at a population level, it gives you a signal. And the signal is important in terms of using the signal to say, look, we think there is something, so let's pay attention to it. It's not, wastewater surveillance cannot be a silver bullet to solve problems, but it is a signaling issue. And if there is some signal, then people pay attention to it. And therefore it is open to, we are already rolling out H1N1 and monkeypox, and we will be rolling out any emerging infections where there is signs that it is possible to use environmental surveillance. There's many limitations to environmental surveillance. However, for as a signaling tool, it's good enough.
Right. So, yeah, as you said, it's like an indication for a lot of things that need to be dealt with under the same umbrella. So, I would like to, ask, how do you see this indication as a system shaping in the next 5 years in India, particularly?
So I hope that cities are inspired by what's happening in Bangalore, Hyderabad, Pune, Chandigarh, and a few more cities that are doing it. And that tier 2 cities particularly feel that it is worth investing in something like this so that they know where to invest in terms of hospital and strengthening and community outreach. To be honest, I don't see where it's going in 5 years, but I can only hope that people and the cities are inspired to take this on, which is easy and low cost, which would have saved us a lot of grief in the early days because we would have been better prepared for it. There is an Indian Alliance for Environmental Surveillance. They are champions and advocates that's working strongly for it to be acknowledged as an important public health tool. And there are cities and technical advisory committees within cities that are champions. So one hopes that there are more champions and so that there's a real uptake of environmental surveillance.
Right, right. So, ma'am, you have kind of presented a picture of how the system is currently in place in our country. And as you rightly said, it's just like a signal or indication for the problems that need to be dealt with. So I think, it's always said that the prevention is better than cure. And I think for that, first step is, being aware and generating that awareness, as you highlighted as well. So I think in that process, listening to the significant stakeholders like you is crucial for understanding the problem at large. And I'm sure our viewers and listeners must also have liked this interaction. So thank you so much for giving your time for such an insightful discussion. It was definitely great and was so much fun to interact with you. So thanks a lot.
Thanks for having me, Jahnavi.
Thanks a lot on behalf of the team of CSR Box. And I hope we get to do more of such interactions in future. So thank you so much.
Thanks for having me, Jahnavi. Have a good day.